Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Jill Krista, who's a pioneering naturopathic doctor, best-selling author, devoted educator, and creative innovator. Her superpower is to make complex medical concepts simple and digestible for the average person. Dr. Jill's passion is to elevate the well-being of the planet by assisting in the healing of her inhabitants. Her books and online courses support those wanting concrete steps to conquer health challenges. Dr. Jill focuses on conditions that cause injury to the brain and nervous system, including mold, which is our topic of discussion today, PANS and PANDAS, Lyme disease, and concussion. Welcome to the show, Dr. Krista.
Thank you for having me.
I was telling you before we started recording, I've been wanting to have you on the show a long time, and we're sneaking this in right before this baby's coming. So I'm apologizing to the listeners if I sound very short of breath. I'm very pregnant and very short of breath, but we'll get through this today. I took your course probably it seems like a couple years ago. I'm not even sure, to become one of your mold literate providers. And I really appreciated your teaching style. You do make complex concepts simple. And so you're just easy to listen to. You clearly have a heart for patients who are struggling with mold illness. So I want to get into mold illness for my listeners because a lot of my patients have this. But before we go there, can you tell us your story? I mean, I know you've personally been affected by mold. So can you share a little bit of your story and how you became such an expert?
Yeah, well, started in southern Wisconsin, real close to you, and found myself in Lyme country. I didn't really realize that that was going to be a big focus of my practice, but it was location, location, location.
Yeah, yeah.
So I went and got trained on that, and it's amazing when you apply the principles of functional medicine, you find and treat the cause,
Mm-hmm.
and to get better. Except with
Yes.
Lyme, there was this group that just weren't getting better, even though I was using this fully integrated treatment, not just the antibiotics, but
Sure.
also all of the tools that I have as a naturopathic doctor. And in one of those patients, they found toxic black mold in his home during a remodel. And it was just sort of this ping moment in my head
Yeah.
that I was like, oh, that's what's going on with his chronic Lyme and why his gut's a mess. He has urinary frequency, he's got ear ringing, anxiety, insomnia, kept spraining joints just from little things. And oh, I know mold is like an allergy problem. And then I know that at that time,
Right,
I
right.
knew that the toxic black mold can sometimes cause neurological things that look like MS. Like that's what I left school with, was like, yes, mold is bad. It's an environmental toxin, and take it seriously. But I didn't really understand it, the full breadth of it. And
Sure.
so when I started hitting the books, it was just like, oh my goodness, I've
A
been
big
missing
deal. Yeah.
a huge deal. It's
Yeah.
way more common than I thought. I've been missing it left and right. I'm now going to go test all my MS patients. I'm going to test all my dementia patients. I'm going to test all my patients with chronic gut problems, all my patients with autoimmune problems. It's just all these people that were the
Mhm.
the long-term complex chronic illness people.
Mhm. I
And
agree. Yeah,
that
I
time
found the
we
same
had
thing. Yep.
same thing, yeah. And that's when I was just like, oh my gosh. At that time, we had real-time labs, urine mycotoxin testing.
Yep.
And then I found these toxins, and then I'm like, well, I don't even understand what they do. So I'm going to go to the PubMed, and all I found was animal research, which we don't have human research because there's a reason for that. We know that the toxins for mold are carcinogenic. They affect the genes. They cause infertility. There's all kinds of things that we know that they do. We can't purposely poison people in a study to figure out
Right.
how to treat them. So I was in the position of, how do I take animal research and apply it to humans? And thankfully, I've trained as a naturopathic doctor. So when I saw rosemary or fish oil or turmeric or things like that used in the study, I could kind of translate that into my comfort level of using those tools with humans. And so I
Right.
just started focusing on mold treatment. And that was the clinker for a lot of these chronic Lyme patients, autoimmune, MS, dementia, these kinds of patients. So that's how I got into it. And then I had a couple of colleagues saying, can I come shadow you? Can I come figure out what you're doing for mold? And I'm like, I'm not really doing anything that's rocket science. I'm just addressing it like a toxin illness. But after those requests, I was like, well, I'll probably create a course on it just to
Mhm.
help people, and moved into a home that, while I was making the course on mold illness, had mold, and it duped me. And it wasn't until the leak got saturated enough that it started raining through my kitchen from the bathroom above,
Yeah.
that I was like, oh my goodness, this is water. Oh my goodness, this has been mold all along. And it's not me going into perimenopause and my kids having a worsening of their autoimmune disease, just,
Mhm.
I mean, yes, they were having that, but the cause was mold. And that's when I thought I better write a book
Yeah.
because I knew the treatment that I wanted to use. I knew the remediators, the inspectors, I knew so much about the
Right.
process. And I felt so grateful, so lucky to be in that position that I
Having the
thought,
knowledge you had, you mean at that time? Yeah.
yeah,
Yeah.
yeah, that I was able to just go into action mode. And that's when I thought, okay, I'm definitely finishing my doctor course. I'm going to expand it to add some things that I didn't have in the first run. And I'm going to write a book because everybody should have a manual when they're in that position. Brain fogged, not too many words, and a lot of action steps
Your
of
book
it.
is wonderful. Yes. Yes. So we need to plug that at the end also to remind listeners. But what's it called? Breaking the mold or what's
Break
it
the
called?
mold.
Break the mold.
Mhm.
Okay.
Yeah. Yep.
I have to ask, so all the while, I mean, I kind of had that moment too where water was dripping in from my basement ceiling and I thought, I mean, literally, oh crap, like this is happening to me.
Yeah, you're like,
But
cards shouldn't be wet. Cards should
no, 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 no. Um, did you like what symptoms, you kind of alluded to this, but what symptoms had been happening preceding that? Like in hindsight, reflecting back, were you having challenges? Like was health
Oh
declining
yeah.
up until that moment where you
Oh
thought,
yeah,
oh
of
no,
course.
yeah, yeah.
Yeah. But I mean, we had just had a massive grief in our lives.
Oh,
And
yeah.
so,
Hard to
and the
know what, yeah.
change and the move and, puberty and my kids and just all these things that you can kind of just excuse it away. And I see that so often in my patients. The fatigue starts and you think, it's all right, I'm getting older, maybe having a 20-minute nap every day is a normal thing for people as they age. I'm like 40.
Uh,
Be needing a nap every day. But
no,
yeah, there's those little things that for me it was a lot of hormone changes too. So
sure.
and in my kids, they were in puberty, so I was just like,
Yep.
well, this is just a rocky puberty, and it just excusing all kinds of things away. Um,
And
yeah.
good thing you had the knowledge you had to have that aha moment. And I know you went through a lot of remediation, and maybe we can come back to that at the end because I feel like that's the most difficult part, at least for
Mm.
me in Iowa, guiding my patients on who to help them with inspection and remediation. But before we get there, we have to backtrack. We have to go back to I just kind of want to ask you, what are different ways that damp or water damaged buildings can impact our health? You mentioned personally what happened to you and your children, but just in general, kind of what are some symptoms of mold illness? And then we'll kind of break down, what mold spores and mycotoxins and fragments are. But in general, what are symptoms that patients might experience when they're exposed to mold?
Then there's the problem because it can be many systems and many symptoms. There are some really kind of common and classic ones that come with mold, and fatigue is number one. Well, one of the things we know about mold toxins is that they affect mitochondrial function. And so that's going to affect basically the running of a system. The body just goes on low power mode. So I think
Yep.
about it like, how glitchy and tweaky your phone can act when it has to switch to low power mode. That's what happens with our body, and
Hmm.
that's not just your energy and
Sure.
your ability to think clearly and those kind of things. That's also all the enzymatic processes, all the autonomic nervous system processes that run in the background that we don't have to think. It's time to blink your eyes, or it's time to, increase your blood pressure because you just stood up. Like we don't have to think about
Right.
those. It's running in the background. But if you have mitochondrial function, those things don't work right. And so you can start to get low battery mode on all the processes in the
On
body.
all organ systems too, right? Because we have
Oh,
mitochondria in all cells. Yeah. Yep.
yeah. So mostly we see fatigue where someone it can spread the gamut from where you started. So if it's a competitive athlete, they may say that they have a longer recovery time after exercising, but it may be somebody who cannot possibly exercise anymore because they're too fatigued and they pay
Yep.
for it for 3 days after they've done it.
Yep.
Body pain and fatigue and that kind of thing. So fatigue is a really common one. Anxiousness is also very common. And that has to do with the fact that, you're breathing in things that are toxic, but you can't see it. And a lot of times you can't smell it because the mycotoxins don't have an odor. So they
Right.
could be coming into the indoor space and there's no sensory thing that's saying
This is
I'm
bad, or yeah, yeah,
yeah.
yeah, yeah.
But the survival part of your brain is like, hello, we're getting this chemical every time we breathe into our nose and our lungs. We got a problem. And so people feel a sense of unsettled, a sense of anxiousness, a sense of just like a little bit internally amped, and they can't
Sure,
quite figure it out. Like they just can't breathe. They can't exhale. They can't rest. So
sure.
fatigue, anxiousness, and then we can
Yep.
kind of go from the top down of the
Yeah, yeah,
body.
do. Yeah,
Headache,
yeah, yeah.
vision changes. Very common to get vision changes because mold affects not just the actual retina of our eye, but also the visual processing in our brain. So people will go in and get their glasses changed, and then 2 weeks later they're like, "These aren't working. My eye doctor's terrible." And it's not that; it's that you're taking in more toxin, and the vision is
Sure.
changing. And so it can be, good and bad days depending on your toxin load.
What about
Ear
eye
ringing is
floaters?
very.
Did you
Oh yeah.
say are eye floaters also a potential? I was thinking you said that in your course. I couldn't remember. Okay, yeah.
Yeah, eye floaters, and that's connected to the liver.
Okay.
So the taurine, the amino acid taurine, is part of our bile, and it's also what builds the retina of our eye. And the more mycotoxins that we are exposed to, and the more binders someone is on, potentially they can get into a taurine deficiency. So you'll see more floaters, more debris in the eyes connected to liver toxicity.
Sure.
Yeah. Ear ringing is very common. If we think about the medications that cause ear ringing, most of them are derived from mold. So one of the most common
Interesting. Yeah. Okay.
antibiotics, a lot of antibiotics, the like azithromycin, those
Yep.
cause a lot of ear ringing. The macrolides, they're derived from mold. So that's really common to
Hmm.
have mold related ear ringing.
Yeah.
Lung problems, sensitive lungs, asthma. So those would be the allergic kind of things.
Sure.
And I skipped the nose, like allergies, hay fevers. That's if you're getting exposed to a lot of spores.
Sure.
And then we can see a lot of gut problems. Tons. You name the gut problem, mold can cause it. So it depends on if you're exposed to more spores or more toxins. You can see anything. If it's a lot of spores, you can see a lot of more inflammatory, like eosinophilic esophagitis. That's a
Sure.
really common thing that people are like,
Sure.
I have it. My doctor doesn't know why I have it. I'm like, check your house for mold because it's
Right.
really. And then the toxins can cause degradation of the lining of the gut. So that's where we'll see more ulcers, more ulcerative colitis, more Crohn's, that kind of a thing.
My brother had diarrhea. Thankfully, this was like 5 years ago, whatnot. But when he was living in the Pacific Northwest in a home that was very moldy, he just every time he was in that house, he had chronic diarrhea. I mean, it was
Yeah.
terrible. And I kept, we had done food sensitivity testing on him from a distance. We had tried to help him, and I finally thought, is there mold in that house? And sure enough, I mean, it was just it was full of
Oh,
mold, and it was like it wasn't immediate, but he absolutely started improving immediately after exiting that environment.
yeah.
And now that's sorry, I'm putting his health out there, but I don't think he cares. That's one of the symptoms he gets. He also rented an apartment in Missouri. Same thing, had happened, and he discovered that's kind of his symptom, which I kind of like that he knows what his symptom is, his main symptom when he's exposed,
Totally.
because then he knew certainly enough in the fireplace in this older home, it was mold, and he was able to get out of his lease, and he's in a mold-free environment doing much better now. But I do think it's important that patients are able to kind of identify what those symptoms are, because that's his alert, his cue to like get out, as you say,
Yeah.
just get out. Yeah.
Yes.
But we don't
I
always think diarrhea is due to mold. I mean, no GI is putting that together. I mean, half the time GIs aren't even asking patients what they're eating, let alone asking about, mold exposure. So,
totally. I'm so
yeah.
glad you mentioned that because sometimes we can see those symptoms as a weakness. And actually, that's a very vital response. That's what we should
Our
have.
body's
That's
protecting us. Yes, it's a good
totally.
thing. Our body, yes,
Yeah.
yes.
It's like, okay, we need to have more urination and more
Flush this
defecation.
toxin out. Yeah.
Let's get it out. Yeah. So I think that's actually when I see bigger symptoms like that, when there's a direct exposure and then you get that symptom, I'm always like, ooh, good. This is a vital person. I don't have to tiptoe around as much in my treatment
Mhm.
because I know that they have the vitality to just go ahead and start them on the antifungals and get going. So
Yes.
yeah, I'm glad that you mentioned that because you would think a lot of times we talk about SIBO with mold,
Yep.
but you can have diarrhea even not related to SIBO at
SIBO.
all.
Yep.
Mhm.
Yep.
Yeah. And then urinary frequency, we can see hormone changes, skin changes galore because that's our
Rash. Yeah, that means
yeah.
I hate rashes because you never know exactly what
Where did
is
that come
causing them.
from?
But yeah.
Yep. Yeah. And then toenail fungus. Whenever I see somebody who has toenail fungus, I'm thinking, oh, you have mold. You're either colonized or you're in mold right now. So yeah, those are all like, you should not be starting just like a tree in the forest. The ones that start to get the growths, you know that it's a sick tree. We
Mhm.
shouldn't have growths on our trunks, on our toenails. Like that is a big warning sign for me that there is something going on inside the body.
Thank you for mentioning that. And I think, the extreme example, well, you mentioned, you were putting together, I need to look for mold in my autoimmune patients, but also cancer patients, right? So hopefully we can find mold when patients are having the subtle, well, diarrhea maybe isn't subtle, but these more subtle symptoms before you get to things like kidney or major, liver issues, cancers, autoimmune disease, whatnot, but they can be attributed to mold. I love in your book, you say mold will take over I think you said like your body, your building, your belongings, like it'll take over everywhere. Yeah.
Yes, it does. Yeah. I mean, it's just trying to do its job. That's its job in the universe is like or on the planet is decompose things and gets what's useful out of them, like little nutrients, and then contribute that to the forest floor. Except our buildings aren't connected to that network. So it's in here just acting very unnaturally because we don't live in nature. So
Sure.
yeah, it's just trying to do its job.
Well, let's kind of break that down. So obviously patients are probably familiar with mold spores. So can you differentiate like what a mold spore is and then what a mycotoxin is? Because obviously those are different and much smaller, whatnot. And maybe even get into fragments too. We were talking about this also before we started recording. I recently had Brian Carr on the show and he talked a little bit about this. And that's why air testing that's only looking for spores misses a lot because it's literally only looking for spores. But it's good for my listeners to hear from more than one person
Yeah.
the dangers of mold. So well, maybe start with the spores and then let's get into like mycotoxin fragments and maybe even biofilm.
Sure. So we have the ways mold can make you sick is spore
Yes.
exposure, fragment exposure, which is when the spore is broken. And then we have the chemicals from mold. So when mold is actively growing, it's going to secrete these chemicals. I call them mold farts, just to, that's awesome. And then there are these weapons that mold makes called mycotoxins. And then in a different
okay. Yeah.
environment, you will have bacteria, which can be different kinds of bacteria. So gram negative or gram positive, they have different things that they do. So endotoxins, which I know you talked about with Brian too, those are just bacterial cell wall. So it's just a broken up bacteria, but they irritate the body a lot and they irritate the lungs a lot. And then there's actinomycetes, which when they're growing, they make antibiotics. So if you're in a water damaged building, you could be exposed to all of those aspects. And each one is
Yikes.
going to cause kind of different symptom pictures depending on the soup of that building.
Sure.
The mold spores are what we would see if we went to the CDC's website and we looked at mold illness. They'd be describing what I call spore illness. And in my patient base, that's
Only.
just
Yeah.
that.
Yeah.
Only. Yeah. And that's basically they're describing allergies from mold. Which by the way, if anyone has told you're allergic to mold, check your building because we should be able to handle the mold coming in and out of our airspace through clothing. And we bring some spores in with us every time we walk into our house. We bring spores out with us when we leave our house. So there is a normal amount of contamination, we might call it, although I just think of it as like the natural biome of a space. But if you have an allergy to it, now your bucket for tolerance is full. Why? Now you might live in a really moldy or damp area like the Pacific Northwest, except Pacific Northwest has a lot of cedar trees and a lot of essential oils in the air. You can smell it. That is helping to control that growth. So you shouldn't be allergic to mold for starters. Okay. Something is filling your spore bucket. So we have that. That's kind of the CDC's website. Allergies, hay fever, postnasal drip.
Sure.
If it's real bad, it's asthma. And if it's real bad, it's aspergillosis. So the mold has moved in and is infecting your lungs. That's all you're going to see, but that's like 10%. And so now we have spore fragments, which are made anywhere from 300 to 500 fragments from one spore. And just to give everyone an idea, 1 flat inch of mold, those spores, that's about 1 million spores. So if you have that broken up, which Brian, I love his rose example.
Yeah.
Love that. Yeah. That can break up into 300 to 500,000, or that'd be 300 to 500 million fragments from that 1 inch of mold. So if people are just like, oh, it's mold, but it's only a little mold. I'm like, do you realize that only a little mold, 1 inch round square there or thing on that plate? That's 1 million spores. That's crazy.
It is. It is.
Yeah, that's a lot. So these fragments, what they will do is they will bypass our clearance system because they kind of hook in like asbestos. They're like a little fish hook in our breathing space. And then our body is continuously making secretions to try to move that out. And it can irritate the mesothelial tissue, which only means something to doctors. But if you look at mesothelioma from asbestos exposure, mold fragments can cause exactly the same picture, which the mesothelial tissue lines our organs. So you get these generalized abdominal pain, lung symptoms, that kind of thing. So that's the fragments, bad news. And a lot of people will just focus on those two things, the spores and the spore fragments. And like Brian had talked about, a lot of times the testing is missing the fragment side. So unless we're testing the PCR test, the genetics of it, we're going to miss it if it's broken up mold.
Sure.
That all can be behind building material and not be affecting anyone, but they could still have mold related illness because the chemicals can move through and the mycotoxins can move through into the breathing zone.
And that's why air testing can miss a lot of this. So what you're saying, just to clarify for the audience, is this could be behind your wall, right? So when they're air testing in the middle of the room, like they're not going to be able to capture any of this, yet that still can be impacting your health.
Absolutely.
So just wanted to clarify. Yeah.
Yes, thank you. I love it. Because then people are like, oh, okay, well, that means I need to, do this kind of test or ignore that kind of test. And for me, even in the body, I want to look at all of those aspects. What is their spore load? What is their fragment load? What is their mycotoxin load? What is their chemical load? What is their bacterial load? All of those things paint the better picture.
Yeah.
And that's what we're trying to figure out in the building too. So
Sure.
mold off gas chemicals, the mold farts, that can be anything like an aldehyde, which can make you chemically sensitive. These are people who don't tolerate essential oils because those are high in aldehydes. That could be alcohol, so you can feel more buzzed. You can just from breathing air.
Sure.
And that can be a chemical called mycophenolic acid, which you're trained in that, but people who haven't taken the course. The mycophenolic acid is so good at suppressing the immune system that we use it in medicine.
As a drug, yeah.
As a drug. Now, why would we use a drug that is so good at that? Well, people who have organ transplants, the immune system can attack the new organ. So the mycophenolic acid, also called Cellcept, the drug, will suppress the immune system to not attack a foreign body. Well, why would mold make that? Because then if mold is trying to come in and compost you, you won't reject the fungi. So when we see mycophenolic acid or MPA on a test, then we get really concerned about mold trying to move into the body. That it's kind of that's a virulence factor. That's something that's allowing the mold to move in and
Sure.
also suppressing the immune system. So that's just spores, fragments, chemicals. And all of that is that's again, a very tiny part of the symptoms in my patient base. The majority is coming from mycotoxins. And this is when mold feels competitive and it'll make mycotoxins on purpose to harm another thing. So they're
like a defense mechanism sort of thing. Yeah.
Yep. So they are made as a bioweapon on purpose. They're energetically expensive for the mold to make. So what we know is that it'll only make it if it needs to. Well, if we're finding one mycotoxin, then what does that tell us? There's got to be another mycotoxin from another mold because they're competing. So any building where you're having mycotoxins, you have a mixed microbe situation. It might be other molds, it might be bacteria, but it's basically saying, I'm going to defend my territory and, be naughty. And those guys are bad news. They're toxic to the immune system, the entire gut from your swallower down to the anus, like the entire
Yeah.
intestinal tract. They are toxic to the skin. They're toxic to the nervous system. They're toxic to our organs of detoxification, like our liver and kidneys. They're hormone disruptors. They change the genes. They just are bad, and they're carcinogenic. They cause infertility. They cause birth defects. They're bad news. So that's a really important part of remediation, is to make sure we're paying attention to the particles, because the particles carry these mycotoxins around. They're nanoparticle size, so they can ride a small particle and come into your breathing zone from just inhaling, which
Sure.
is really creepy. Yeah.
I want to mention two things. So one is, in our past office, this is our fourth office, maybe the final office, but in our last office, I was struggling with infertility again, and I didn't know much about mold back then, but I do know that immediately when we moved out of that, I did a lot of things, including surgeries for endometriosis, and which I've shared in my book and shared on the podcast. But what I do know is, upon immediately removing myself again, like I was saying with my brother, from that environment, got into a new environment. I mean, it was within a couple months I got pregnant. And looking back, that space had been a spa before. The lights were very dim and dark, and there was more moisture. And it was an older space, and I just can't help but think I was having dysautonomia. Back then,
Oh,
like
yeah.
POTS-like symptoms again, which greatly improved upon removal from that environment. And so, knowing what I know now, I can't help but wonder if that space was moldy, again, contributing to, like you were saying, infertility. So it's one thing, again, just to keep in the back of our minds, even for listeners, if you're struggling with infertility, this may be something that hasn't been explored. I know you've had lots of these patients, but we've also had patients really from all over the nation who come to us with infertility, and we do all the regular functional medicine things, but sometimes we can't achieve that pregnancy until patients are treated for mold. And sometimes that takes a long time, but we've had a lot of victories where patients are able to get pregnant. And that's amazing, right? They put in the work, the
Yeah.
remediation, and they did the hard work, and they were able to get pregnant. And that's just such a win.
Uh-huh.
But I also want to mention, like you were saying, that, mycotoxins, well, just mold spores, all of this in general is bad for our immune system, that it suppresses the immune system. So a lot of these patients, as you alluded to earlier, even seeing patients with Lyme, have more than mold going on. They may have other chronic infections, viruses, and Lyme, right?
Yeah.
So when you have mold, for the listeners, again, that's suppressing your immune system. So it's making it more difficult for you to fight off these other infections. And if we can get rid of the mold, right, eliminate that variable, then the immune system can function more effectively for those chronic infections. So this is just another one of those layers that needs to be, well, peeled back or treated or whatnot.
Yeah.
So
Yeah. Look at it. Don't avoid it, because
yes,
it can be behind a lot of things. And you could then, it just breaks my heart when I see that, because a lot of us don't want to have that happen. Like when it did
who
happen to me,
does?
I put it off for like a month. I was like, yeah, we better take care of that. I mean, even me, who knew all the dangers. And so I have a lot of compassion for people, but I see, if they can convince their doctor away from the mold, it just is like, don't do that, guys. If you even are kind of wondering, use the dust test, do a simple survey, and look, don't avoid it, because
The
so
longer you avoid it, yeah, the
the
worse you're
longer
gonna
you
get.
avoid it.
Yep.
Yep. And then you're spending so much money on supplements and, doctor visits and all of these things, when you could be addressing the problem. And then your treatment may be supplement rich for a while, which,
Yeah.
it can take a bit to get all of the systems working again, but then you're not on them for life. And then you've prevented the next health issue from coming
Right.
to light.
Right. Think of it that way. Okay. What about biofilm and its relationship to mold? Can we go there? Yeah.
Yeah, let's go there. So biofilm is a result of that immune deficiency. So we have the first shift that happens is in the sinuses, because typically that's where you're going to interface with them, and also the lung microbiome. So we have microbiomes that are unique to each body system. I know you know this one, I'm just explaining it for your listeners, that there's going to be a different microbiome for your mouth, a different microbiome for your tonsils, a different microbiome for your sinuses. So when we're breathing in these toxins, the first thing that will happen is kind of like with your brother with diarrhea, is that the toxin is sensed, and then there's just a lot of secretions. So snot is made to trap it, digest it, move that toxin out of the system. And that's a good response. But then if that continues to happen and continues to happen and continues to happen, and that toxin is immune toxic, it reduces our immunity. Well, where is the biggest part of our immune system is our barriers. It's our skin, protecting us from every microbe that's out there. Our
Sure.
skin is really, really good at that. And our respiratory passages are usually really good at that. This toxin is persistent, it's breathed in, it reduces the immunity. And then the next step from that healthy, normal, commensal microbiome where everybody's getting along and everyone has a job, it's this community. Then they start saying, like, wait a minute, I don't know if I can trust my neighbor because maybe my neighbor is poisoning me. And so then the normal commensals start to act defensively. And then the non-commensals start to move in. They're like, no, I got you. I'll take care of your neighbor and I'll take, so it's just kind of starts from a happy family or a happy, community to more defensive, more alert, more secreting their own defensive type chemicals, to then we can get the normal mold spores that are living on our respiratory passages. Like if we tested all of us, we would all have mold in there. Not everybody is at making mycotoxins. So now those will start to make mycotoxins, and that's more immune deficiency. And now we have guys who can move in that maybe were a normal part in like 2% of our flora are now 50% of our flora. And
Taken
they're
over. Yeah.
good guys. And then we can get mold to move in and colonize in our sinuses. And that's really, for me, colonization, biofilm are sort of the same idea in my head, and because I address them the same way, which is let's digest that, break it down, and repopulate with who we want in that system.
Sure. In essence, I think patients who we do, nasal swab testing on, who have biofilm, they can just be harder to treat, but we can treat them. But it's important to know that they have that. Yeah.
Yeah. Because if we're not, that can become one of the problems,
hindering their healing. Yeah.
Yeah. You're like, okay, we're doing everything right. Why is it that you can't get off all your stuff?
Yep.
And so that's when we say, okay, time for biofilm busting, because now we want to get you, the idea of treatment is it's a treatment time, and then you come off everything and your body heals. And, I know you have great tools like the SBIgG, like all these things for building the immune system. Those are really important for the rebuild. But then once you're rebuilt, you should be able to function.
Yep.
Yeah.
Agreed.
Yeah.
I have a question. Do you feel like women become more symptomatic than men in general?
Yeah.
And why?
Yeah. Higher body fat. That's just, these toxins.
It's a fact. We have more body fat.
Definitely. And the mycotoxins are fat soluble. So that means that we can take them on in our fat stores. And so the more fat stores you have, the more
toxins. Sure.
The more toxin you have, the faster you get to symptoms. So although like the mold that you were probably exposed to with that we know causes infertility, which is Fusarium, that secretes an estrogenic mold called zearalenone.
Yep.
A lot of guys are having low testosterone issues from mold. Huge problem. Especially you're working with infertility. I'm sure you're assessing this a lot.
Well, I just this week, I have a guy, I don't know, he's a junior in high school who has low testosterone, and his he has very high I can't pronounce it, zearalenone, amongst other mycotoxins. And I thought, oh my gosh, this is a very significant finding. And I explained to him and his parents, we've done so much work with females, maybe in the 20s, 30s with infertilities, but now I'm seeing these younger male cases. It'll just be at least I'm very curious, and I'll be very interested to see as we detox him, as a result of that, where his testosterone rises to. I'm encouraged that we found something significant in his case.
Yeah. And in some of the cases where they have a really significant mold exposure for their whole childhood, and so they're coming in their teens, and it's like there's either precocious puberty because of certain mycotoxins will push test too high, or it's deficient. That's a combination of mold mycotoxins and atrazine. That combination has been horrible for young men, to the point where we have to get them on HCG just to get the system right.
Yeah. Can we test for atrazine? I mean, I know we're in Iowa, so pretty much everyone probably has, but I guess, is that on an environmental toxin panel? I don't really remember. Okay.
Yep. Yeah, I love to run that, because then I'm like, okay, now we know. We've got
You
to
need to
make
eat
sure,
organic and yeah.
yeah, and talk to your, where you play soccer or where you play outdoor sports or whatever. Like they need to know this is affecting your testosterone. This is affecting your health, but
Yep.
and the health of the guy who's spraying it.
Heck yeah, I know.
Yeah,
Eh, okay,
I know.
so
It's overwhelmed everybody. That's why air filtration is so great, at home. You can just,
I want to come to air
and
filtration too, but let
yeah.
me also, I guess, let's go back to what's the best way or the best test? You've already kind of alluded to this a little bit to find out if a person has mold related illness.
That's a tricky question because there is no best test for everybody. There is
What are
a
some of the tests? I'll
yeah,
rephrase.
yeah.
Okay.
So the way that I approach this is I pick a cluster of tests that are answering the question we want answered.
Answered.
So typically, and I'm sure you have faced this with patients, you're like, I think you have mold. And they're saying, well, is it in my house now? And that's usually the question is, am I being exposed right now? And why that's important is then we need to know, should they be testing their space, or is this maybe their, could be their office, or maybe it's an old problem that they've moved out of and it's now just a residual bioaccumulation. So when we're asking that question of, is it a now problem? Then I look at a cluster of tests that are going to tell us more arrows pointing to, yeah, I think this is you're being exposed right now to
Sure.
an appreciable degree. So the ones that can tell us that is a VCS test, or visual contrast sensitivity test.
Sure.
When you're actively being exposed to mycotoxins, we talked about all the ways mold can make you sick. When you're being exposed to the mycotoxins, there will be more visual contrast issues. So being able to sense contrast visually. And so that's the vcstest.com is my favorite. It's a really cheap, it's like 15 bucks. You can get an annual membership or an annual subscription that you get a bunch of tests. So if you're like, yes, I know it's mold, and now I want to know if my treatment is working, or if the hotel room that the insurance put me up in while they remediated, if that's moldy, like you can retest yourself as you go. The other one is the MyMycoLab mycotoxin antibody test.
Sure.
So while we can run a mold allergy test, that's another one I like to run in this cluster to see, are you allergic to mold? Again, like I said earlier, if you're allergic to mold, your bucket's full of spores. Like something's up. But you can also run the antibody test to mycotoxin through MyMycoLab. If the IgE is high, so IgE is an immediate sensitivity antibody. It reacts early, and it reacts to things that you're exposed to right now. So if that's high, I have a high suspicion that my patient is being exposed to mold right now.
Yep.
A colonization/biofilm may be able to raise that. It's going to be the rarer case, and that's usually somebody who actually does have infection somewhere in their body, like a fungal ball in their sinuses, or breast implant disease where they've actually they're growing mold. But if we see that IgE really high, even if the IgG is not, that points a lot of arrows to, oh, I think you're exposed.
Sure.
And then a urine, so mold allergy. Also, we run that you can run through normal insurance usually. These other ones are kind of out of pocket, but a mold allergy test we can run usually through someone's insurance. And then I look at a urine mycophenolic acid. Why that? Because we know that is one of the chemicals, and it is being made when mold is growing. So you can have a mold problem that was a problem and is no longer growing. Mycophenolic acid won't be high, but the mycotoxins may be high, and you could be, reacting to them because it's still in the space. But a lot of times that urine MPA is high, the person is actively being exposed to mold. So that cluster helps us get more close to the answer of, yeah, I think it's a current exposure. And then we can do your mycotoxins to test for, body burden. There's lots of different ways to assess this.
Sure. Thank you for putting all those out. And I have to, I will post a link to your questionnaire also, because your questionnaire is wonderful. We use that with our patients too, as just a good screening. I do the Lyme and the, your mold screening questionnaire just to kind of see, okay, which of the two are we maybe looking at? Sometimes it's both.
Yes.
But I like those numbers to kind of lead me. Is this more Lyme or are you limey or moldy or both? What's going on?
Exactly.
So the questionnaire is great, and we'll post the link to that in the show notes again too.
Thanks.
So yes, thank you for sharing all that. Okay, so I guess I want to go through some different treatments. I also want to talk about nasal treatment, and maybe we'll start. You just had talked about kind of colonization and biofilm, so maybe let's go back to nasal treatment first. How important do
Mhm.
you feel like that is? I mean, I know your answer to this, but I'm asking
You
for
want to
listeners.
have everyone hear
Yeah.
it. Huge, 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 huge. So important because it is the top of the tube. So when we're using things to reset the microbiome of the gut, if we're not addressing the sinuses, every time you swallow, you're going to be seeding the gut. Yeah. So it's huge. And it's also our first interface.
Yep.
So it's the one that's going to take on the biggest burden.
Do
Mhm.
you, how do I phrase this question? Do you treat, I'm pretty sure you're going to say yes, you treat every single patient from a nasal standpoint, or just the patients who more have upper respiratory symptoms? Do
Mhm.
you treat both or
They,
focus more on?
if I'm finding mycotoxins either in their urine or antibodies through my mycolab, then I make sure that we're treating the sinuses with something antifungal.
Sure,
So not everybody necessarily needs the antifungal. Some people only need a little probiotic in their nose to help reset that microbiome.
sure.
But I have, I kind of think of it as, and this is another Brian Carrism, if that mycotoxins are the smoke, but fungus is the fire. So if we're finding mycotoxins, I
There
will
has to
consider.
be fire. Yeah. Yep. I like in your course, I mean, for years I've used compounded silver nasal spray with biofilm busters, to help these patients, but we all have those patients who can't tolerate that. And so I love how in your course you listed out, I mean, just trying a xylitol nasal spray, like sometimes there are some really easy over the counter options. And quite frankly, some other guests I've had on the show too that we haven't talked about mold with, but we're just talking about like development of the oral airway and whatnot. They're saying everyone should be flushing their sinuses. We brush our teeth every day. We need to be flushing our sinuses too to keep them healthy. So,
Yeah.
I think using a xylitol nasal spray, there are some easier options than a fancy, more expensive, compounded treatment. Sometimes those do the trick, like I'm sure you're saying. So,
Yeah. And, a lot of people when COVID hit that I was treating for mold, they were like, oh no, I'm so susceptible. My immune system's down. I'm like, don't worry about it. If you're using propolis for your antifungal in your
sure,
nose and to
sure.
keep histamine down and some of those things, the studies are showing that that's effective against COVID too. So you're probably covered. And so let's just see, and it was really interesting to see the people that were very consistent and used the propolis,
Less
they
likely
did
to get,
have, Mhm.
yeah, that's
Yep.
awesome. That's
Isn't it
wonderful.
amazing? So
Yeah.
yeah, there is that kind of just, protecting that gate, so to speak.
Yes, yes.
Mm.
Beyond nasal treatment, what are some other, I mean, listeners just need to follow you on Instagram. You have awesome Instagram, read your book. You have a course for providers and for patients, if I remember right.
Yeah.
But can we go over, I know there are a lot of different opinions on treatment for mold. But you're the guest today. So
Yeah.
tell me, tell me, in your opinion, kind of what are some of the most effective kind of steps in treatment? And we also obviously have to get to like remediation and removing the body from the exposure. But as far as treatment is concerned, kind of give us some of your tips for that.
Yeah, so the encouraging thing is when everyone hears that there are different approaches, is there's no one single way. So if something that you're trying isn't working for you, try a different way. There is no, rule, because each of us as practitioners is attracting patients that resonate with us in our approach. So we're getting a selection bias that way. So I will tell you what's working for me and my patients, but again, if it's something that someone tries and like, yeah, I tried that, try something else. We all just want you to feel better.
Right,
That's like
right.
the
Yeah,
whole
good
point here.
answer. Yeah.
Yeah. So the way that I approach it, I have kind of a little diagram in the book called Peel the Orange, because as I was thinking about the steps, I was like, okay, but two of them really need to be done 100% for people to get better. And then the other ones we can pick and choose. And so I was like, oh, it's
Sure.
kind of like peel an orange and you pick and choose the section. So came up with that visual. The general methods are number one, avoidance. So you have to get out of mold. Number two, fundamentals. So those are the two that are like the 100%. Think of that as the outer orange layer and then that white fluffy layer when you're peeling an orange. The next steps, number two, three, and four, is protect, repair, and then fight. And the fight is where we use the antifungals. The fight is where we reset the microbiome, we get rid of biofilm. But the protect and repair, the reason that I have this process this way is that I did it a different way and people got worse. And so I would start with the antifungals. Like when I was telling you about my Lyme patient that I was
Yeah,
like,
yeah.
oh, this is fungus. Okay, well, we'll just get him on antifungals. And, he got way worse. He had terrible die off. He had this neurological stuff went through the roof, couldn't sleep, anxiety, nothing was working, and I was like, oh my goodness, I think I'm missing something. So, we did all the die off stuff that I learned through Lyme, which has now, as I look back, I was like, oh, I didn't prepare his body for this big die off. And we know the things that mold will do to defend itself. Mold will make more mycotoxins once you administer antifungals to defend itself. So we know if the body already has a load of those, if we haven't taken down the body load before we start the antifungals, we're going to max out the body's load of
Sure.
toxin. So that's what protect and repair. The essence there are things like bioflavonoids.
Yes, you love those. Yes.
I love those. And that's from animal studies. And that's also from just the pharmacokinetics of how we detoxify mycotoxins. So we have 2 kidneys and 1 liver. And we detox through both of those things. So it makes sense to me that we would maximize the majority of the organ systems to help them detox mycotoxins. A lot of these mycotoxins need specific bioflavonoids like zearalenone or like astaxanthin to be able to denature the mycotoxin from the blood protein that's carrying it, so the kidneys can detox it. The kidneys can get rid of it. So I have a little rule of thumb, bioflavonoids before binders, because bioflavonoids are addressing the kidney, which is 2, and the binders are only really addressing the 1, which is the liver. So if we can do bioflavonoids, get the kidneys being able to clear the toxin, we've just taken down the toxin load. And a lot of people, if they don't tolerate binders, they get freaked out. I'm like, do you tolerate like juice? Like do you tolerate vegetable? When I'm saying juicing, like juicing vegetables, that's a really easy, cheap way to boost someone's bioflavonoids. And you
I was going to say, give examples of bioflavonoids for the listeners.
Yeah. So bioflavonoids, think of every color of the rainbow has a bioflavonoid that clears mycotoxins. Isn't that cool?
Mm-hmm.
So that's why I love a product called Color Guard, because it's like it goes through all those things that are specific for kidney clearance. So this is resveratrol, the purple, lycopene. Wait, I should do the Roy G. Biv. So lycopene is the red. Beta carotenes. Those are just, we all know about beta carotene. It's not sexy because we all know about it, but it's very good for getting rid of these mycotoxins through the kidney. Other orange things is astaxanthin and zeaxanthin. And then we have quercetin in the yellow. So quercetin, rutin, lutein, luteolin, these are all in the yellow band. And then the green band, we have folinic acid. You don't want to take folic acid, which I know you've
Yeah.
but folinic acid to support the green. And you can also use herbs like nettles for that are antihistamine and, solving many problems. And then we go to the purple band, which is resveratrol. So all of those bioflavonoids, and a lot of us have heard these. Oh, green tea. I forgot about green tea, polyphenols, very effective for clearing out mycotoxins through both the kidneys and the liver.
Do blueberries count?
Blueberries count. Yeah.
Because they're darkly pigmented.
Better. Yeah. Right. And, a lot of like grapes and things like that. The Oregon grape, the actual grape is really great for getting. So there's a lot of things that we have available. So yeah, when we get into that, people ask, well, what about the blue to purple, that maki berry, acai, those kinds of things. But we can look for the specific bioflavonoid that will help kidney clearance. And now we've just really taken the burden off the liver. So when somebody has a lot of eye floaters, I was taught in school, treat their liver. And now I'm like, treat their liver and their kidneys, because if we can help the kidneys, then we're taking the pressure off the liver.
Sure.
So the other things in protect and repair then would be binders, and then things that protect the organs of detoxification, like milk thistle, turmeric, things that are high antioxidants like glutathione, or the precursor alpha lipoic acid, NAC or N-acetylcysteine, those kinds of things. So it's a huge toolbox that we have.
I know you're a big fan of melatonin also. Can you just allude to that a little bit?
Yeah.
You mentioned CoQ10 in your book too, but I know melatonin was a big one. So why is that so protective for these patients?
It's the #1 brain antioxidant. So these mycotoxins can get into the brain, and that's where we get problems like dementia. That's where we get problems with the nervous system and how it's functioning, like MS. But it's also protective to the kidneys. And I feel like that's and you heard this in me say this in the course, the
Yeah.
kidneys get forgotten all the time, and they're doing the lion's share of the work. There's great research, and both animal and human research on the protective effects of melatonin on the kidneys. Like
Awesome.
anybody listening that has any kind of kidney disorder, talk to your doctor about melatonin, have them look it up. It's tons of studies in PubMed, and that those organs just take such a hit with mold exposure. I'm a huge fan of melatonin,
Yeah,
not just for sleep. It's not, I
so-
don't use it for,
more than
yeah,
that, it's antioxidant. Yes, yes, I seem to remember that.
yeah.
You said something else I was going to comment on, and then I forgot. You talked about bioflavonoids, glutathione, resveratrol. Well, maybe it'll come back to me. That's all right. Um, oh, I know what it was. Binders. You were mentioning binders. So this is also why I do really think for patients, testing for mycotoxins is important, because I just want to mention to the listeners, because many patients try to treat themselves from home and some do make progress. But
Oh
if we can
yeah, I do.
identify which mycotoxin is high, we can then identify the appropriate binder for that mycotoxin. So rather than someone just randomly go take activated charcoal or bentonite or, whatnot, I do see huge value in being able to test the patient so that we can then personalize the binder treatment too.
And
There's-
the whole treatment,
Yeah,
like when I refer to mycotoxins, I'm kind of doing them a disservice, because what we're talking about is how they're all consistent, but they are all different in how they're detoxified and what they do to the body and the way that we get them out of the body.
yes,
So I think that that's the personalization is really also about how is that mycotoxin broken down? Like what organ system can we support?
yes,
So I do
wonderful.
have fact sheets on
Also
my
why you need a
website.
provider to help you along this journey. Yes.
Yeah.
Let's go
It really
back. Oh.
shortens it.
I keep saying let's go back, but let's go back to, before you talked about like the protect and repair, obviously that the first step is really removing the patient from the exposure. And I'll tell you, in Iowa, we have had a challenge finding good inspectors and remediators who really know what they're doing. So do you have any tips for patients who are struggling to find these, inspectors and remediators, or what, if any, encouragement can you provide to our listeners on that topic?
Yeah. Well, and again, I would encourage everyone to listen to your interview with Brian Carr about the dust test and about,
Yep.
yesweinspect.com. They've really solved a pain point for a lot of my patients, because I work with people all over the country.
Yeah.
And, I mean, we've got patients in Kentucky and, places like that just don't have access. And I know in Iowa, it's the same thing. The person that I work with a lot in Madison, she was driving down there a lot to do these inspections because there just weren't a lot of resources. And, one person can only do so much. So I think they've done a nice job of creating a kind of DIY supported testing,
Sure.
so that you can at least be getting good advice on the inspection part. The
Yes.
remediation part, there's a lot of really great remediation companies, but they really do a better job if they have the inspection and a really good inspection, and then the inspector to say, these are the precautions that you're looking for. I would, Brian talked about the air test, like somebody that just comes in, places an air test, 30 minutes, and then they walk out. That is not a sufficient inspection. And if you're calling around to find a good inspector, especially clinicians, this is one of my best allies in my practice, is a building biology trained inspector, because there's more than just mold. We have EMFs, we have, mothballs, chemicals,
Formaldehyde, all kinds of things. Yeah.
all
Yeah.
the things, off-gassing granite countertops, and, just all kinds of things that they're going to pay attention to.
We have like one building biologist in general in the whole state of Iowa.
Oh, geez.
Like we need a huge opportunity here. Yeah.
Yes, anyone listening, if you
Yeah.
want to start a business. Yeah, yeah. So I think if you're interviewing inspectors, I ask them how long it takes them to get through an inspection for your square footage. So a 2,000 square foot home, how long does it take you? And if they're like 30 minutes, that is not a good inspector.
Yeah.
So like a 2,500 square foot home, that should be 3 or 4 hours.
Yep.
Yeah. So that simple thing. And then to say, do you work with sensitive people? And if they have said yes, and then got a sensitive person they actually don't, they will avoid you, because they know how hard it is to work with sensitive people. And that's a great question to ask,
Sure.
oh, have you? How many? So if it's just like one, they haven't worked with enough to know how to take the extra
Sure.
precautions for you.
And I would definitely say you want a pre and post test. I mean, even back to that dust test, pre and post, so that you know for sure the
Always.
remediation got everything. Yes.
Yeah. I mean, they do that in skin cancer. Why wouldn't we do that in mold remediation?
Right,
Doesn't.
exactly. What about air filtration? What should someone look for? I wanted to come back to this because we mentioned it previously. What should someone look for in selecting an air filtration device that's going to filter down to like a small enough size to get rid of all of these things that you mentioned, the mycotoxins and the fragments and whatnot?
It needs to be down to a micron level where we're able to address the small particulate, so ultra fine particulate. So the mycotoxins are down at the 0.0,
0.1, is that?
yeah,
Okay.
like micron level. They're nanoparticles. So we want to make sure that you have something that's getting down to that level, and not everyone's going to be crazy like me and go get a particle counter. But it might be, if you've been mold affected, it might be something to invest in and actually test the machine. And I do this. I have some videos, on Instagram and on my website and things like that, where we've tested machines and we're looking for things that are getting that ultrafine particulate. The second thing though with mold is that we want to make sure that the filter itself can't become a petri dish, because once you put that filter into a biofilm environment with a lot of competitive toxin fire going on, the more that filter takes on the particulate, if there are any viable mold spores there, that filter can become a petri dish of its own. So I like the IntelliPure because they zap the filter, and so it creates a biostasis. So even if a spore gets on there, it
It's
now
gonna
will
get killed. Yeah.
it's going
What
to get
about
killed.
the
It's going to get
filters?
broken.
A lot of these devices, like you remove the filter, like you're throwing that away. So that's,
Mhm.
I mean, you're replacing it essentially.
Yeah, yeah,
Is that
yeah.
acceptable? I mean,
Yeah.
because, okay,
Yeah, it's just that you want to make sure. A lot of people will, so that's a big thing with air filters. Whatever you choose, change it by the schedule or a little early, because
yes,
that's where the problem happens, is people are like trying to
save
save
money and
money.
weight and yeah, yeah,
It's a pain in the butt to change the filters. You just don't
yeah,
get around to it, and those kinds of things. So
sure.
change the filter on
And
time.
this, just to clarify too, like when I'm talking about air filtration, for the most part, I'm talking about standalone units separate from your furnace. Most furnace filters are not filtering down to this small, if I'm saying this right, micron
Yeah,
size. Because a lot of patients say, "Oh, I changed my furnace filters," and I'm like, "Well, we got to do better than that." Like,
at
so
least do
just
that.
at least do that. Please do that. But in
Yeah.
addition to that, yeah, we
Yes.
can do better. Yes.
Yeah,
Awesome.
definitely. And that's, there's only so much air you can shove through a really good filter. So if you need to get enough air movement to actually heat the home or air condition your home, that filter can't be too tight or you're going to run into problems and wear out your furnace. So each furnace is kind of rated for a certain pressure against a filter that it
Sure,
can
sure.
push. So that's why it's important to have room units. And I like what Brian, do your priorities is, where do your
Or you
kids sleep?
sleep.
Where do you sleep? Start there.
Yep, yep, I totally agree.
Mhm.
Couple more questions for you. This has been wonderful. Okay, we talked about kind of supporting the kidneys and the liver and treating the nasal passages. What about supporting our lymph system? How important is that for helping us to excrete toxins? And if it's important, what do we do? How do we do that?
Huge, huge importance. And I talk about this in my book with the lymphatic massage, with sauna. You can do it with sauna. And also, I love mud baths. There are these particular kinds of mud that will be an exchange. It's not just a sweat out, but it also contributes to the microbiome of your skin. It contributes minerals, because a lot of people with mold related illness have mineral deficiency. So it's this really beautiful exchange of, like, the mud will take all the toxin and it will give back all these nutrients.
Remind me, where do we get that special kind of mud?
Yeah, that mud is on my website.
Okay.
Import it from the Czech Republic, and it's very clean. It's called Peloid therapy, or Moor mud,
Yes.
OOR. Yeah. And in my course, Mold for Kids, I teach you how to use it on infants, because that's a very safe way to detoxify an infant. Because you can't be pumping,
Right, right.
harsh stuff into a little baby.
I think being as pregnant as I am right now, I definitely have some swelling in my lower body because the belly's compressing the lower lymphatics. But I look at pictures of this pregnancy compared to my last pregnancy, and even like doing interviews and whatnot, and I was just, my face was just large. And most people say, if they only see my head, I mean, once I see my belly, all bets are off. But when they just see my head, they say, you really haven't gained a lot of weight in your face. And I've been getting lymphatic drainage full body every 2 weeks this whole pregnancy.
Good for
And
you.
I can't help but wonder. I asked my therapist too. I said, "Do you think that's why my face isn't so puffy and so swollen?" I mean, I'm a little swollen. I'm not saying it, but comparatively, right?
Ah,
I just feel like that was a likely the biggest variable in helping minimize a lot of this, the past puffiness that I had. So yeah, I mean,
mm.
lymphatic drainage is good for so many things, but I know that it's really benefited me this pregnancy as well. So
Wow,
that is
what a user's manual or user's guide to pregnancy. I hope everyone is listening to that. That's so important. Yeah.
Um, all right. What about ozone? You do mention ozone in your book as another supportive therapy. So how does ozone help these patients?
I really love IV ozone, but I couldn't put it in my book because I wanted to put things people had access to.
Sure, sure.
So in the doc course, we talk about IVs a little more, but I love it because mitochondrial dysfunction is the blockage.
Mhm.
That's the blockade. And when we can provide enough oxygenation into those tissues, the mitochondria can start running again. And then, all the downstream stuff happens because mitochondria are in every cell. So that's our nervous system, our immune system, our gut wall, all the things that can break with mold. So that's the way I prefer to use ozone. You can also use it for nasal, to make sure we're getting rid of the biofilm.
Yep.
But really yeah. So that comes,
Yeah,
my favorite is to put it in the veins. Yeah.
we offer that, we call it MAH, major autohemotherapy, where we take blood out of patients, we ozonate it, and then we let the blood run back into the patient. And you really hit that on the spot. I think a lot of chronic disease in general is just a state of decreased oxygen utilization. So if we can oxygenate the blood, well, that's going to absolutely support the mitochondria. So the body gets stronger, the immune system gets stronger, plus ozone has antifungal properties and biofilm busting properties, like you said. So that for many of our patients who are already doing all the right things, but they want to expedite the process. If it's in their budget, getting ozone treatment can be very helpful. So I did want to plug that too.
Yeah. And are you seeing you with the real mold affected people? You have to start just one pass or one.
We do. That's yes. I'm not doing 10 pass yet. Yeah, I think that was overkill. I've had some patients, well, at least report going elsewhere and it really backfiring. Like the first time you get ozone, don't do a 10 pass. Like
Don't
that
do
just
10.
seems
Yeah.
silly to me.
Yeah.
So yeah, no, we do not do that. We're simple. We do one pass. Yeah.
Yeah. Yeah.
But
Yeah,
multiple treatments. So we'll do like one a week for
right.
12 weeks or whatnot. Yeah.
Come back. We
Yep.
don't have to do it all at one. Yeah, that's just such a more gentle way to do it.
Yep.
Same here. Just like we're just gonna give you little bits. So little bits of progress can make a big difference over time rather than crash people.
And if the patient has, which many of these do have, again, Lyme disease or other chronic infections, like we're supporting the immune system to fight all of the above.
All of it.
And sometimes we'll couple that with IV vitamin C, whatnot too. So yes.
Okay.
Before we wrap up with final couple questions, anything else on mold that you want to share? I mean, you were a wealth of knowledge. We broke a lot down today. Is there anything else that we missed that you feel like needs to be highlighted with mold treatment?
I don't think so. We covered a lot.
Well, I told you I had to ask you really quickly, just at the very end of the show, because I have had many patients whose children have had PANS or PANDAS, and I know that's something else that you specialize in. So could you just quickly share for our audience, this is not, the topic of the show today, but what PANS/PANDAS is and kind of what symptoms these parents should watch for in their children, kind of cueing them in that this may be a problem and kind of how you approach that.
Yeah, it's a really common result of having mold exposure as a young kid. So that's the connection. Why are we talking about that with mold?
Yeah.
Mold can lead to this a lot. And I don't know that I have a case of straight PANS that doesn't have mold exposure in their history.
Good to know. Yeah.
So PANDAS and PANS, we talk about them the same because the symptom picture looks very similar, but they're different causes. So PANDAS is pediatric autoimmune neuropsych disorder associated with strep. So it was a strep infection that kicked it off, or at least that's what we're going to agree. Mold first, and then the strep happened. And then PANS is pediatric acute onset neuropsych syndrome. So they both have a case where a kid was a healthy kid. Of course, now we are finding that a lot of them had immune deficiency, kind of low lying. And
Sure.
then they have a toxin exposure and or an infection, and they changed. And the change is anxiety. That's the most common symptom. So that's going to be separation anxiety. So they can't leave their room. They can't leave a parent. They
Mm,
will melt down if they have to do that. They'll get angry. They'll get abusive, that kind of thing, because they're just so anxious. We can see OCD type symptoms. So compulsions,
yep.
repetitive behaviors, things like that. And we might see tics. We might see urinary frequency. Might see eating restriction. So there are a lot of and behavioral changes. So
Sure.
this idea that you know all behavior is just a brain problem is this is breaking that old paradigm that
Sure.
we realize that this is a body problem that is affecting how the brain works, and when that happens, it's affecting a child's behavior.
Yeah. Um, I know you can't just tell me your treatment in 30 seconds, but for, can
Well, I
you,
can actually. I can tell you. I kind of have it broken down into
okay, okay,
core four
give
is
us
what I
the
call it.
quick, yeah, sure.
Yeah, the quick core four is we've got to tame the flame in the body and the brain. We have to beat the bugs that are taking advantage of this low immune situation. We've got to regulate immunity, get their immune system back up to function, because that's what set the stage in the first place.
Yeah,
And then guard all their gates. So that would be their nasal gate, their dental gate, their environmental exposure gate.
sure.
So we're maintaining, or we're preventing any new infection, toxin, that
Yep,
kind of thing, so that we don't continue to flare the autoimmunity. It's just like a
perfect.
celiac
Yeah,
person needs to go off gluten,
yep,
it's the same thing.
sure. Wonderful.
Yeah.
Thank you for sharing that. I didn't want to miss out on, yeah, that little tip. Well,
Yeah.
tell us again kind of where listeners can find you. I know you just recently got some funding for a trial, so explain that as well. And tell us about your
Yes.
social media channels and all that jazz. Yeah.
Okay. So they can find me at drkrista.com. And if you are struggling with a certain mycotoxin, they can go to drkrista.com/enter the mycotoxin. So aflatoxin, zearalenone, ochratoxin, and you can get a fact sheet so you know
You have great
what
fact
is
sheets.
that
Yeah. Yep.
toxin. Yeah.
Yep.
Just kind of to take it, simplify process a
Yes.
little bit as I'm trying to do. I do have a questionnaire on my website as well. If you go to drkrista.com/questionnaire.
Okay.
However, right now, if you're listening to this when the study is still live, Dr. Nathan and I just got funding from the Change the Air Foundation to test the questionnaire against symptoms. So we would love if you would go to moldiq.org and participate in the study. That would be taking the questionnaire on the day you collect your samples, and then you can come back later and submit the test results. And that helps us publish research that helps everybody with
Yes.
illness. Yeah.
Awesome. Wonderful. Great. We'll post a link to that in the show notes as well. And then tell us, last but not least, your top longevity tip.
Get outside.
Haven't heard that one in 180 episodes yet. That's good. Yeah, yeah.
Get outside. It's very simple. It's free.
Well, in your
And
book, you say you say light is mold's kryptonite, I think. You
yeah,
say something like that. Yeah. Yep.
yes, exactly. Yep. Light is mold's kryptonite. And also just the grounding. We get so much from being outdoors that, we evolved doing that. So our bodies need that. It's a nutrient. Outdoors is a supplement.
Vitamin N, nature, or whatever they
Yeah.
call you.
I love it.
Great tip. Well, thank you so much for coming on the show, for all your time today, sharing your story, and for really kind of pivoting your career to create educational platforms for providers and patients so we can help more patients get better and heal from these illnesses, that there really is hope. So I hope all our listeners check out your social media, your book, your website. We'll post all those links. Thank you again. This was wonderful.
Thank you.